starting the timer, and here is the question. Have we done this recently?
No, ma'am, we haven't.
Okay. Right. If you have read and understood, kindly begin your history taking.
Okay, I will enter the room. Hello, good morning.
Hi, Doc. How are you?
I'm good. How are you?
I have some pain, here in tummy. Can you see?
Okay,
Can you help me?
I'm really sorry to hear that out. So first, let me introduce myself. My name is Dr. Ishfaq. I'm one of the doctors working here. May I confirm your details, please? Your name and age, please.
Yes, I'm Linda Robert, 35.
Nice to meet you, Rina Robert. Okay, actually today I have been asked to ask you a few questions regarding your condition. Will that be okay for you? Is this the appropriate time?
Yes, Doc. But there is pain. I vomited a lot.
Okay. Do you want me to give some painkillers first before we proceed?
Good.
Yes, it would be good. Yes.
Very
Okay.
good.
I will be asking my nurse to be giving some painkiller. Okay.
Yes, please. You can.
So can I proceed?
Yes.
Okay. Can you please tell me what exactly is the pain?
Well, Doc, I drank a lot on last weekend. And,
Okay.
Since yesterday, I had 3-4 times vomiting.
Right.
I vomited a
Right.
lot, and there is also some pain.
Okay.
Here, right here in my tummy.
Okay. So do you think it started all of a sudden, or it started gradually?
Well, I had such kind of pain even before, but it started suddenly.
It starts. Okay. Right. So can you please describe the pain for me? Like it's what type of pain it is? It's crushing, it's stabbing, it's like dull.
Well, it's dull, but now it has intensified.
Okay. So do you think it is radiating to somewhere else, like it's going backwards to your back, like downwards, upwards, or it's there only?
Sometime to the back.
Sometime to back. Okay. So you have also told me like you have been vomited. Do you have been observed like there is any blood in your vomit?
No, it was, food contents and green or white in color. No blood.
Okay. Right. Do you think anything makes your pain better, or it's getting worse with something?
Yes, I take some medications, morphine sometimes.
Right.
So it
Okay.
helps.
Okay. So do you think like it's there all the time, or there is any particular time of the day, like it's increasing or it's decreasing, or it's there all the time?
It has no specific time.
Okay.
More with the food. More with the
food. Okay. So if you have to rate your pain, like 0 to 10, 10 being the worst imaginable pain, how will you rate it?
So you can say it's now 4 to 5.
Okay, it's 4 to 5. Okay. So do you think have been experiencing any issues with your bowel? Have just like any diarrhea, any constipation, any blood with your stools?
So can you please repeat? You want to say blood in the stool? No,
Yes.
I have not noted. No blood in stools.
Okay, right. How's been your bowel habits recently?
Well, It's,
Any
once a day,
that?
sometimes after 2 days, sometimes once a day.
Okay. Did you find it difficult to flush your stools?
Yes, doc, I have noted for last few months, it's quite sticky,
Okay,
so it's not
right,
flushed easily.
right. So how has been your appetite recently?
How? What you said?
How has been your appetite recently?
Well, for last few days, it's not that good. I have noted some decrease in appetite.
All right. Have you observed any weight loss recently?
Not much. I have not noted.
Okay, you have noted that. Okay. So can you please tell me, is have you any other condition you see your GP for?
Have I ever got? Sorry, there is voice break.
Have you any other condition you see your GP for?
Well, I have diabetes as well, so
I'm sorry to hear that. Do
I'm
you take
on
for that?
diabetes medications as well.
Okay.
So
So do
apart
you have
from
the
this,
okay,
I,
okay, okay. Do you take any other medications?
yes, I told you painkillers. The
Okay.
and I'm also using insulin and glucophage.
Okay. So have you had any surgeries in the past?
Well, in the past, when I was child, I had appendicectomy. No
Okay,
other
right.
surgery.
That's right. Okay. So do you mind if I ask you some few personal questions?
Of course, you can.
Okay, what's your occupation? Can you please tell me that?
I'm working in a club. I'm manager of that.
Okay, great. That's great. So do you smoke or do you drink alcohol?
Yes, I smoke, 5 cigarettes a day, and on weekends, as I told you, I drink a lot, maybe 5 or 8 units
Mhm.
of vodka.
Okay. Okay. So who is at home with you, and do you have any difficulties at your home, like with upstairs, going upstairs or moving around?
I'm living with my wife and my 3 children.
Okay.
Sorry, my husband. Sorry.
So,
So,
okay.
Yes.
so
Okay, okay, that's okay.
I don't have any problem while going upstairs, but nowadays due to this pain, I feel discomfort.
Uh, I can understand. So before proceeding further, can you please tell me what do you think, what might be causing your problem?
Well, doc, seriously, I'm in a pain, so I need
Mm-hmm.
for it. I don't know whether it's some ulcer or some cancer or anything. I don't know because in one
Okay.
of my friends
Yes, sir.
just died recently of some
Okay.
cancer.
Okay. So this is your biggest concern. Am I right?
Yeah,
Okay. So what are you hoping us to do for you?
please, doc, relieve my pain.
All right. That's right. Surely, I can do something for that. So can you please tell me, have you been observing, like, do you have any joint pains, muscle pains, any shortness of breath, any chest pain recently?
I have occasional cough, nothing more.
Okay. So is there anyone else in your family who has experienced the same thing before?
Well, my uncle died of gastric cancer.
I'm really sorry to hear that. So is there anything else you would like to tell me that I have missed?
No, thanks, doc. So nice of you.
Okay. Okay. Thank you very much for your time.
Can you
All right.
present your history now, please?
Okay, a 35-year-old lady, Mrs. Linda Robert, presented to emergency with complaints of pain abdomen. That's there from the last 3 days. From the last one day, she has been experiencing the pain previously also. She has also complained that pain is radiating to the backwards. It is dull in character. It is associated with three episodes of non-bloody vomiting.
Yes.
She has also complained that her stools are difficult to flush. She was a bit drowsy and toxic looking. Linda has a history of diabetes and she's taking more medications for that. she had appendectomy in her childhood. Linda has habit of drinking alcohol, like 30 units per day, and however, she's not smoker. She has a family history of cancer in her ankle.
Yes.
So taking this in consideration, I would like to make my provisional diagnosis at acute appendicitis.
So what
Sorry,
are your
acute pancreatitis.
Yes. So what are the differentials that you will consider?
I would also like to rule out the chronic pancreatitis, any pancreatic malignancy, acute
Yes.
cholecystitis, any bowel perforation, acute appendicitis, diverticulitis.
What investigations would you carry out for this?
Firstly, after thorough history examination, I would like to run some tests like blood investigations, full blood count, urea electrolytes, LFTs, and I would like to do some raise inflammatory markers like CRP, ESR. Then I would like to arrange an ultrasound abdomen and pelvis in this patient, and particularly ultrasound hepatobiliary system in this patient, and maybe we may need abdominal X-ray standing in this patient, and CT abdomen later in this patient. The renal functions are normal, and maybe we may need ERCP and MRCP in this patient. And
what do you think should be the treatment for this patient?
Okay, so we can manage this patient firstly conservatively. So according to the ABCD protocol, managing airway, breathing, circulation, disability, and exposure, they give the patient adequate amounts of fluids, analgesics, and we have to relieve his pain following the WHO later protocol for the pain. And as the patient is complaining of features of chronic pancreatitis, we can keep the patient give some. Later on, we can consider enzymatic replacement as well. But presently, we can also give patients some prophylactic antibiotics if recommended.
Okay. What else would you do for the patient?
I would like to.
As patient informed you that patient takes morphine every now and then, and you maybe did not ask the dose. How much dose is normal to take?
Okay, so morphine. I can't remember. She don't have to. She don't have to exceed the 10 milligram per day.
15 to 30.
Okay.
Per milligram per 4 hours. But would you send her for any psychosocial management or?
Okay, as a patient is taking morphine and her life is really disturbed, I would like to have the psychiatric consultation and cognitive behavior therapy in this patient. I would also like to arrange that for her.
Good. Yes.
That's right.
Yeah, and maybe you can involve endocrinologist to monitor or control the diabetes. Yes.
Yes, I will discuss that with my consultant and with her GP, and maybe we need to refer her to the endocrinologist for her blood sugar controls and the replacement of the pancreatic enzymes as well.
Okay, what measures would you do to manage her pain?
So
would you send her to pain management? Yes.
And I would like and before that I would like to follow the WHO pain management protocol, starting with the PS paracetamol, NSAIDs, and weak opioids, and then strong opioids. And if it's not still, we may need to go for the celiac axis block if that is required. That will be decided by the pain management department.
Yeah, good, excellent. Thank you.
Thank you.
You had a wonderful patient today.
Yes,
was
exactly.
Giving you the exact
exact information.
Sounds. Yeah. Thank you, Dr. Nidhi. Thank you, Dr.
Thank you, Dr. Nidhi, really.
Yes, dependency counselor. Great. Excellent. You didn't know, it was totally like a surprise for you. So excellent. Yes.
Thank you very much.
Anyone else want to give feedback, except for the timing went little above because we understood Dr. Was talking like softly, and
yes, ma'am.
So network was not functioning properly as well. So all right, yes.